Welcome, everyone. My name is Sarah Anderson, and I just wanted to thank you so much for joining us today. I'm the Executive Director of the Bay Area Global Health Alliance. The Global Health Alliance is a global health community with nearly 60 members, universities, academic institutions, NGOs, community-based organizations, and other folks caring for the most vulnerable in our population, as well as private sector members, including many from the tech sector. Together, we're really trying to build cross-sectorial connections, collaborations, and collective intelligence to advance global health innovation and equity. Upswell is one of our key members. Its founders, Sarah Francis and Drew Bernard, have kindly offered to pass along knowledge and insights on content strategy for public health communications. They kindly provided training last year for us near the beginning of the pandemic to help public health communicators improve their messaging in order to help fight misinformation and provide public health messages that would help people keep safe and save lives. I learned a lot last year and look forward to learning more today. Feel free to pose your questions in the chat, and Sarah and Drew will answer as we go along. Please also know that we are recording this session. And without further ado, let me thank so much Drew and Sarah for having this session with us and sharing their expertise with us. And I'm going to turn the session over to them. So thank you.
Great, thanks, Sarah. That was such a kind welcome. We are excited to be here. So I'm Sarah Francis and my colleague Drew Bernard, and we're going to be talking about content strategy for social media. And hold on while I share my screen. It's always the technology people who have the worst time sharing a screen, so please be patient. All right. So we welcome your questions as we are presenting. Drew and I are very informal, and we'll have plenty of times after the presentation. We have about an hour total, so we'll have plenty of time after the presentation to take questions and talk more in depth. So what is content strategy? Content strategy is just really simple, right? It connects the needs of so when you're thinking about your content strategy, you think about your mission and the needs of your community and how you can, both serve your community and your mission at the same time. And that's what we think about when we think about content strategy. And there's 4 components to effective content strategy. The first and one of the most important things is to know your goals and understand how you're going to measure them. So for whatever platform you're using, today we're talking primarily about Facebook. Thinking about how you're going to measure your progress to those goals and mapping those out at the beginning before you start anything else is crucial. The next thing about content strategy, and we will talk a lot about this, is understanding your audience. When you enter in a social media plan or any type of action on social, you're entering into a conversation with your community. So it's great to understand who you're talking to. And then you optimize for that specific channel, right? What you post on Facebook may not work so well on Instagram, might be really different for if you're communicating in a Facebook group, and it's obviously very different if you're communicating on Twitter. And then you'll measure and evolve, right? So one of the best things about social is it moves really fast. So you have all that time to quickly pivot, take what you learned, your successes, your failures, and start another conversation. So anytime I'm getting ready to do anything on social, even though it is something that I do all the time, every day right now, I like to ground myself in the differences between broadcast media and social media. So in broadcast media, your message is your story, right? So you type up your op-ed piece or your press release, and it's really clear that that is what is coming from you. So if you write that op-ed, that's in your name, no one can change that story. On social, it's really different, right? Your message is your supporter's story. It's when you, they can take your message and share it with their friends and family. They can even edit it to make it their own. On broadcast media, you publish once and you reach many, right? You get your advertisement in a newspaper or on the radio, and it reaches many, and that's just one time. On social, your conversation can be repeated over and over again and changed throughout the conversation. And it's a really different mindset to think about, right? It's always a dynamic conversation. On broadcast media, you control the distribution, right? You decide if you're going to be above the fold or what channels your advertising is going to be on or what billboards or where you're going to hang your flyer. On social media, and this is really hard for a lot of people, your community controls the distribution. And that's also really exciting. On broadcast media, your reach is earned through placement, right? You can have a terrible ad and it can be above the fold, whereas if you have a great ad, it might be buried, depending on how much money you spend on your ad. But on social media, and this is my very favorite thing, is that your reach is earned through your engagement. It's earned through how you're communicating and having a conversation with your community. So on broadcast, your costs don't change, right? Your costs are dependent on who you're advertising with. But on social, your costs really decrease as your engagement increases.
And Sarah, let me jump in for just a second to talk a little bit more about the paid side. So you can tell that as Sarah's talking about this, we very much take what we call an organic first approach to creative. So the things that Sarah is saying make perfect sense when you think we're just doing organic reach, but that's actually not really what she's talking about. She's talking about paid and organic. And there's very few things that we do on social these days that doesn't have money behind it. All of the things on the right are also true when it comes to paid. As she said, if your content is highly engaging, people are really behind it, they want it to become part of their story, your costs are much lower. The other thing and we'll talk more about this later, but the other thing that's happening on the right-hand side is that on the left, your message is branded you, right? So all trust, a person when they think about your content, they only have you as the focal point of their thought process when they have to analyze, is this a credible source? That's very different on social media because the message is often coming from you, but it's coming through someone else, right? So if it's coming through Sarah Francis for me and it relates to social media, I'm thinking I probably should read it because I know that she's way geeky and the kind of person that I would want to kind of be following behind on that.
Image for that.
Yeah, go ahead.
So when in traditional communications, right, it starts from the halls of power or from the organization right to the people, right? So it's a one-way street. So that's what Drew was talking about, right? It comes branded from you and from your organization, or it's a press release from a CDC or a WHO. And when social first came online, we really thought it was going to be a two-way street, right? So, there's a press release, so a Facebook page puts out a statement and people respond to that statement. But that's not how it is in reality. And that's exactly what Drew was pointing out. It's actually a conversation, right? It's many to many. So, it comes like your statement on your Facebook page or on your Instagram channel, or even on Twitter, right? Lots of people are passing it around, adding on to it, changing it, evolving it, sharing it with their friends and family. And that's really important because, as Drew said, you have a different level of trust with your friends and with your family than you do with the WHO. And when you think about it, we think about the, the idea of who really we listen to, right? And there's been a lot of distrust recently in the media, in government, and it's really gone down. But we still have a lot of trust in our friends and our family. So, that becomes really interesting, and what you can tap into, that power of social. Do you want to add anything here?
Yeah, I do. The one thing I'll add here is there are some stats that at times we'll put stats on this slide that'll show, like, percentage of people who trust government or what have you. And it's been really interesting for me personally watching the numbers when there's a lot of people out asking questions. Do you trust social media? And it's always, I almost like laugh every time I see it, because no, nobody trusts social media. But no one is coming to Facebook thinking this is social media. They're thinking this is a post from Sarah or Drew or my friend or my parent. So you think about when we talk about social media, we're not talking about the platform. We're talking about friends communicating with each other that happens to be coming through an electronic device. It's also worth keeping in mind that something like 60 or more % of all sharing, electronic sharing, is happening on what's called dark social. Meaning it's not on Facebook, it's not on Instagram, it's not on these. It's actually it's email, or it's a text, or it's some other thing that no one ever sees. So a lot of the sharing that's happening, same things that we're talking about here that happen to be focused on these. When you all are thinking about this, you're thinking about Facebook and Instagram and these channels. In reality, a huge percentage of what Sarah's talking about is also happening. This sharing is also happening off of the platforms as well. So anyway.
I was just going to pile on. That's such a good point, Drew, because when we were working on a campaign in India a few years ago, we kept seeing our numbers of shares on Facebook were really, really low. And that was rather disappointing to us, because the shares are really what we're leaning into, is really the power of social. But the number of saves, of post saves, was high. In fact, I've never seen post saves really anytime I do a campaign in the United States. And when we talk to people who are of this community in India, they said, yeah, we save these posts, we save anything that we think is funny, and then we share it on WhatsApp. So that, population moving across platforms is really interesting and important.
Okay.
All right, so now we're going to talk a little bit about the Facebook algorithm. So Facebook's #1 job is to protect each person's unique feed and make sure it contains only the stuff they really like to consume. And so what does that mean in reality? What does that mean when you're thinking about your content strategy? So we like to think of it as an iceberg, right? If you or my little brother spends all day, every day on social media, they might be able to see all of the content that they can, right? But on average, every person in the pages we're connected to and the friends that we have, each person has a potential to see over 3,000 posts. But none of us actually spend all day on social, right? We use it in the in-between moments. And even now, as we're getting back to our daily lives after the COVID lockdown, we'd use the moments where we're waiting for a friend or a family member at a cafe, or when we're waiting for public transportation, or when we just have an in-between moment when we're kind of bored. So that means that when we're popping in and out of social, we can only really see on average 250 posts. And so the Facebook algorithm, because it's designed to serve us what we like to see, chooses that top 250 posts. And our job when we're thinking about being social communicators is thinking about how we get in that top 250. And so how does this algorithm choose what posts get in that top 250? What posts rise to the surface? Well, it's a very complex process, and I don't even pretend to be able to understand or being able to explain all of it. But in a nutshell, there's 3 things that the algorithm looks at. First, it looks at your relationship to the author. And it doesn't have to be your familial relationship. So it's not like, oh, it's always going to show you posts of your that your mom makes. In fact, if you don't engage with your mom's posts, you're never really going to see them. It's going to show you the posts that you engage with the most. And then it's also going to look at the type of posts you engage with. So whether or not you look at pictures or, like all the baby photos or click on the links, right? My husband and I both have a similar friend circle, but his Facebook newsfeed looks radically different than mine because I'm always attracted to the images, right? And he's always an article reader. And then it also looks at immediacy. So what news stories, what moments are rising I'm in Seattle, Washington. So what's happening right now? What are my friends and family sharing? And it looks to find articles or posts among my friends circle and rise those to the top of my newsfeed. So again, those three things are relationship, type, and immediacy.
And the only thing I'll throw in here is that there's probably 27 additional factors, right? But these really are three. If you think about these things, it's kind of the 80-20 rule, right? Or the, dare I say, the 97-3 rule, right? You get like 97% of the value for, just thinking about the three. If you think about these three things, you're going to be in a pretty good position. But there is, as Sarah said, there's tons of complexity, obviously. And Facebook is very guarded about the algorithm for a bunch of reasons. But these are three things that if you just keep these in mind, you will be doing well by yourself and your community.
So here's just an example that everyone's newsfeed is unique, right? It matters what you do and not who your friends and pages that you follow. So it matters if you engage with what types of posts and who you engage with most. So how do you create this shareable content, right? How do you take what Drew and I were talking about with the algorithm and work to see if your post can land in that top 250 without ads? So Drew and I always are organic first, thinking about what succeeds organically. And then if you have an ad budget for your campaign, putting the money behind what is working. So there's three reasons why people share content, right? Facebook has done a lot of research. Drew, do you want to talk about?
Yeah, happy to. Yeah, so there's really three things, and as I talk about this, think about it. Like, think about what I'm saying and reflect on your own use, right? So think about what was the last time you shared something via social media, via text, via email, with someone that was purely because you were sharing it with them. It wasn't work related, but something you shared. The number one reason people tend to share stuff is because they think it will be useful to the person that they're sharing it with, the person or the people, right? So I'll share a single, I just sent an article, if you saw my newsfeed, it's all articles all the time. I shared an article with my wife about 20 minutes ago. Because I think she'll find it useful. It'll be interesting for her and she'll find it useful. And that really is the number one reason that people share content. The second reason is that they use content to define themselves. And you think about, I almost think of this as almost a filter, right? I can't remember the last time I purposely shared something on Facebook that made me look bad, right? Now, I generally am constantly saying things and doing things that probably do make me look bad. But I generally I'm not going to Facebook and, saying things that genuinely make me look bad. I might say something self-deprecating or a joke, but I'm not going to, go to Facebook to do something that makes me look bad. So that you can almost think of this as a filter. But the other side of that coin is people really are using your content to define themselves. So in the health space, what that often looks like is I share content to show someone that I'm thinking about them, that I care about them. I share health content because it defines that this is the work that I do. I'm compassionate, I'm caring. You think about the content you share. Facebook is a place, and all of these social platforms are a place where people come to show, not tell. It's, I'm going to show you something about myself, and that's what actually makes it interesting. It isn't just people coming and telling you what they want you to know about or what they want you to hear. They're showing you what they want you to know about them. So using, sharing content to define themselves is really the second big piece. And I kind of think of it as a filter. If you push out a piece of content that's going to make the person who shares it look really bad, probably not going to get shared, right? So, but that's a bit of a filter, but also really the sort of the number 2 reason people share content.
Drew, I want to go back to useful
Yes.
really quick, because I want to highlight that we are not thinking that social is serious all the time, right?
Yeah.
I think useful here is a value. You can think of it as a value. So useful can be, I know this will make my friends laugh, because, and that's useful to my friends, right? It's entertaining. So I think that's an important balance to say. And sometimes taking off our professional hat and leaning into how it's just an informal conversation with friends and family is really important.
Yeah, and the third bucket that is a little different, right? So as Sarah was saying, that top one of useful can just simply mean valued, right? It's like, what's the value of this content to my friends and family? This last one is impactful. And this is one of the things that Sarah and I talk a lot about, and that we benefit from constantly in the work that we do, is the kind of content, the kind of work that you all do, the kind of stories in your lives and in your work have a massive natural advantage on these platforms. And this is a big part of the reason for that. Not only is it often seen as useful, not only do people want to be seen, sort of associating with it, but this last piece is really important. People share content because they think that that content can make a difference in the world, right? Can make a difference in someone's lives. This impactful thing is, it really is kind of where I'm going to say there's, good has and this is, I know, despite all the crazy stuff we see in the media all the time, good does have I would even say sort of unfair advantage on these platforms, because we're talking about human beings, and human beings are sharing content with each other that they think can make a difference. Even when we look at things like misinformation and disinformation, almost no one, very, very few people are actually trying to share content on these platforms to hurt each other, right? To trying to hurt their friends and family. The thing that's really hard about some of these things is that people actually believe it, right? And so you have to understand that and think about it. But this last piece of people sharing content to have an impact, to make an impact on the lives of each other, on the world around them, is sort of the third kind of big bucket that, again, if you're thinking about your content, and we'll get to this in a minute, is a very good thing to be thinking about as you create content. So I'll tell this story. It looks like you're still on mute. This was a really fun project that we did a number of years back. Actually, we didn't even do the project. We were coaching and teaching the WHO social media team a number of years ago. It's way back in 2016. And when we do this, one of our favorite things to do is to go in and find the highest performing piece of content that an organization has pushed out. Instead of going and saying, this didn't work, let's try to figure out what would work. Instead, we look and go, gosh, this thing really worked well. What's going on here? So one of the things that we were doing with the WHO team was we were trying to just get them to think about creating content that people would really want to share. So the team went away on their own, and the next thing we know, the I think it was World Health Day or World Health Week came along, and they pushed out this piece of content that was just a video that was a book, a children's book called The Black Dog, which is a metaphor for depression. People probably know that. I didn't at the time. And at the time, they couldn't use Facebook ads at all. They were organic only. And this piece of content, all of a sudden, it's just started taking off. It was shared 60, 70,000 times. It just took off. And so one of the things we did is we did two things. One is we were working with a team at Facebook, and we were able to go out and survey the people who shared it. And we asked them why you shared it, essentially. And lo and behold, those three things above was exactly the things that people told us. The second thing we did is we went and we analyzed all the comments that people made. And it was, I swear to God, reading these comments, it was like, gives you hope for humanity. It was these incredible comments, people saying things like, hey, it was great seeing you last week. I hope you're doing well. This made me think of you. Or, all of these things where people were sharing this content because they cared for people. So this was, I thought, just such a great example of that in action. And if you think about it, it's just a children's book, but it was a very poignant tool that people could use. So WHO was giving a gift to their community. Anyone who knew someone or either suffered from depression themselves, they might have shared it to show the world what they were dealing with. If they knew someone that suffered from depression, this was a tool they could use to support that person and start a conversation. Or if they just thought it was important for everyone, again, they could share it. So this was just a really great example of just absolutely magical content. And it was all because they really thought of this as, how do we create content that empowers our community to support each other? So this was just a great example.
So going back to what we talked about when we talked about how you think about a content strategy, one of the first things to do is to sit down, think about your goals and how you're going to measure them. So for this example, this is an example that we're actually working on right now that is trying to motivate people to, and in specific community health workers, to take one more step down the road to getting vaccinated against COVID-19. So one of the goals is to increase vaccine uptake, right? And so how we're going to measure that is we're actually using a treatment and control, or treatment versus holdout in audiences. We're going to prompt and drive vaccine registrations. So how we're measuring that is clicks or signups. So thinking about how you can measure is really important to map out at the beginning. So that's all laid out as you're running your campaign. And if you're using Facebook ads, or even if you're using you have an organic first content approach on Facebook or on Instagram, the reporting has gotten so much better recently. It used to be really hard to figure out, especially if you're new, either to managing a page or an Instagram handle or to running ads, and they've both gotten really amazing. The next thing you do is you define your audience. And with social, one of my favorite things is you can get really specific. And as public health experts, you all know how important it is to get the right message to the right person. So you can be really specific in understanding your audience, and then you can create a persona in your mind or on paper about a representation of that audience. So I like to, for example, if I'm running a donations campaign, I think about, for my nonprofit, who my likely donors are. I will, imagine, a donor that I know from my nonprofit, and then all the content I am writing is going directly to that person, and I often have a name for that person, right? Like Sally, and I talk about what Sally would motivate Sally to give, or what would motivate Sally to take the COVID-19 vaccine. So thinking about who your audiences are, what needs your key audiences have, what barriers they may have, like, is Sally busy? Does she have children? Is she, juggling home life and work life? And thinking about what motivates your audience. My favorite question to ask when I'm thinking about creating content for a specific audience is, what would get this person so excited she would share this content with her friends and family? Drew, do you want to talk about this slide?
Yes, this is a relatively revised deck, so I was kind of curious there if you'd even see this deck or this slide. So there's a few new slides in a deck that Sarah and I have done this quite a few times, but there's a few new things in it specifically for this project that we're working on. So I think that one of the things to keep in mind as well, and we're not talking about today, is what we're really focusing on today is how do you create content that works on social. There's a little bit that we're talking about how you actually create content that has an impact in the world, right? I mean, but we're not really getting into that a whole lot here. We could do a whole nother session on that, but this slide is really kind of meant to sort of, point out that you really have two goals when you think about content, and Sarah did say this from a strategy standpoint. What's your mission? What are you trying to accomplish? What are your goals? And, at the same time, you also have to be thinking in terms of what's your engagement goal? Would you, if, again, back to, how do I break through a busy news feed? So the engagement side of this, you have to be thinking about on the content. What we often see in the health space, we often kind of joke that there is no place on social for PSAs, right? So PSAs almost by definition are kind of like talking at people. That's kind of how they were designed. They were radio and TV and billboard, and that's kind of how they were designed. Much more powerful is when you can give someone a message and they carry it for you. So you really have to be thinking when you're thinking about social. We don't have the luxury of just posting cute cat pictures or cute pictures of Sarah's friends that will engage her, right? That won't move the dial. So we always have to be thinking about how will this content move the dial from a campaign standpoint? And oh, by the way, that's not enough either. We also have to have that content be something that people want to engage with. So that's really the purpose of this. And sorry, Sarah, I forgot that I don't know if I described that slide to you before.
No, that was great. So thinking about your metrics again, so measuring is so important. So you're thinking about on social, some of the metrics that we look at is the basic one of reach. So how many people, and again, that, if you're doing organically, that's kind of an important number to watch. If you're thinking about it from a paid standpoint, I think of reach as, it's not the goal of your campaign, right? The end goal is your impact or your conversions, the next step that people take. Then you look at engagement. So those are your likes and your comments, and most importantly is your shares. And then you think about your impact or your conversion. So the next step that someone can take.
Along those lines, you can kind of see that almost a little bit like a funnel, right? So one of the things that's nice, even with a paid campaign, is to look at the reach and then say, well, what percentage, not just the raw number, but what percentage of the people that we reach are going to this next step of engaging? And depending on how narrow your audience is and what you're trying to drive, if you're trying to reach a very specific narrow audience and your engagement rate is really low, then maybe we're not nailing it. But that being said, if you have a really wide audience, you're not going to have a huge percentage of people who you reach engage with it. But kind of looking at this as almost like a funnel is generally kind of the way to look at them.
Andrew, you bring up a really good point, because I always get asked the question, well, what is a low engagement number? What is a high engagement number, right? And so you can't benchmark off other orgs or other things. I strongly recommend benchmarking off of your own campaigns, right? So what's happened on your channels over the last month? What does your engagement look like then? And then benchmarking off of your what you've done in the past, and always trying to improve.
And in a perfect world, you would have your end goal in mind of, let's say it's changing behavior, or it's we're trying to drive, in our case, in the one campaign, we're trying to increase people getting vaccinated, or getting people to sign up for a vaccine. Thinking through, okay, our ultimate metric here is we want people to sign up. What's the cost? Kind of like literally like a conversion cost. So, thinking through what our end goal is and what's the budget, if you will, that we have to accomplish that last piece, and then kind of working backward from there. But like as Sarah said, there really aren't any good, even between two posts or two projects that within your own organization, you'll often find that engagement rates will vary quite a bit. I would suspect, though, that if you're thinking about this stuff all the time, you will find that they go up, because you just get better at sort of pattern recognition and creating content that it does draw people in and drive to more engagement over time. And oh, Sarah, you're muted.
Sorry, I'm like juggling a loud dog, so I keep going mute and unmute. So we've been talking a lot about the theory, right? And we've been talking a lot about setting the stage. So thinking about your content strategy and how you build it and why people share. And now we're going to get into the nuts and bolts. So really, like when you craft either a Facebook post or an Instagram post, we don't have stories, but we would love to talk about them, and we'll have plenty of time for questions at the end. But here are some nuts and bolts. So the first thing you have to remember, and you guys know this, is the majority of people use Facebook and Instagram only on a mobile device, right? They will only ever see your content on a tiny screen. And if you're running a campaign outside of the US, most likely it'll be on an Android device. You really have to think about the screen you're designing for, right? So it has to be legible, little amount of content, big pictures of big faces.
And when she says that, every rule is meant to break.
Oh, yeah.
Yes. Yeah.
Totally. And please know that Drew and I are not experts. In fact, if anyone calls themselves the social media experts, you should totally run in the other direction, because social changes all of the time. So really think of yourself as someone who's experimenting on social. And to that end, you have just a second to catch people's attention, right? Thumbs are really, really fast and getting faster every day. So thinking about how you're going to delight and surprise your audience is really important. The number one thing to do is to avoid sounding like a PSA. I love this infographic from Granada. I think they are awesome. It's a tiny, tiny team of one person. And I think it's so funny, right? It's super surprising to see. And it definitely delighted and surprised their audience. And ask yourself, I mean, this is one of the most important things to do. Ask yourself, would you share this content? And if the answer is no, think about how you can change it to be more shareable. And that doesn't mean you need to like go back to the drawing board with a graphic designer. In fact, sometimes the best social, is created really quickly just by yourself, right? So just think about the post copy itself and how you can change it, whether or not you can start with a surprising fact or ask a question. Go ahead, Drew.
Yep. So as Sarah was just saying, I mean, so one of the things that we do pretty much, I'm going to say religiously, that might be a little overstated, but is we really focus on sort of a quantity first approach. So one of the things that's so incredibly powerful about social media is the fact that you can push out a ton of content very fast, and you can very quickly learn from people what's working. So we take what we call a quantity first approach, which is, again, quite different than a lot of folks do, where it's the opposite of what I often refer to as sort of the plan, build, launch, which in my experience often is followed by wah, 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 right? Instead, what we do is we do very fast, very high volume content, and we figure out what's working. And then, oh man, that's working really well. Let's do some more like that, right? So we're constantly in this rapid iteration phase. I was just, there's a great quote, right? That all progress is experimental. And that really is how we approach social. And one of the things that I think gets missed about these platforms is how good they are. And I'm going to say specifically Facebook is so good as a channel to test and iterate and learn what content is working. So this, if there's a couple of slides in this whole deck, this is probably this whole concept of making it okay to fail, that Sarah uses this term called the joyful funeral, which I think is kind of like anything that has the word funeral in it. It sounds terrible, but it really is true. I think that, of the organizations that we've worked with, and we've worked with a lot that are very, very successful, maybe sometimes despite us. But I think that the one thing that has led to much of the success of the organizations we work with is that we make it okay, and in fact, we expect them to be failing. And they begin to take that in. I think there's often a fear, if I'm pushing something out on my Facebook page, it's going to say something about me, and there's this like really heavy lift around, it's like I'm being put in the New York Times on the front page. You're not, right? One of the best things about social media is if you put something out there and it doesn't work, nobody sees it, right? I mean, that's the whole thing. If the algorithm says nobody's going to want this, then very few people are going to see it. You don't have to put a lot of money behind the stuff that isn't working. But this concept of sort of throw everything out there is truly, I would say, the secret to success on social. It really lies in here. It also is, it's the 10,000 hour rule. You probably don't need to see 10,000 posts, but I guarantee you, if you've done 500 instead of 25, you're going to have pattern recognition, and you kind of quickly begin to learn more and more. So try it, let it fail, learn from it. If you look at it and say, man, I don't know why that didn't work, then iterate it, play with it a little bit. Sometimes that just means just changing the text in the post. Sometimes it's like, maybe it's the wrong image. Let's try that again with a different image. but it's that constant, never take it's basically like, like never, never let a failure pass by without learning. But if you're not failing, you're probably not getting the full value out of the platform. So really testing lots of things. We could tell story after story of where we've seen this happen, and incredible successes, and they happened after 50 posts, right? So anyway, yep.
Here's some specific things for you to remember when you're crafting. This works both for Facebook and for Instagram. Is that, again, it's mobile first. Images need to be viewable on a tiny, tiny screen. Infographics, break them up. If it's a really dense infographic, maybe you can do it in a couple of different posts. And then also try images that really focus on people's faces. I find that group shots never work as well as a close photograph, right? Something that invites you in and wanting to spend a little bit with the post. On video, you always need to use captions. Drew and I say all these rules are meant to be broken, except for this one.
I agree.
You are speaking, you are mute when you are on Facebook, right? Everyone has their volume off. Your videos start with the volume off. So it needs to be understandable without sound. Your videos have to be short, unless it's something that's really, really amazing and really, really interesting. 10 seconds or less, and always start with your hook, right? This is not the time to have a big intro. Start with your punchline. And I always recommend going live and giving people a sneak peek behind the scenes or doing something surprising. That's going to, jump the Facebook algorithm, and it's going to be delivered to all of your fans' news feeds.
That, and just really quickly on that last point, that really is more of an organic piece. So if you have 5,000 fans, then going live is a really great way to get there without paid. So this was actually the slide when I started my story earlier, which was like, wait, where was he going? The answer was I was going nowhere, because I was actually thinking about this slide when I started talking. This is the slide. This again is a WHO slide. This is the one I literally was thinking about when I was talking about the other one earlier. This was the example. The post on the left was by far their highest performing piece of content, and it was killing it. I mean, this thing was being shared and engaged with all over the place. And I want to point something out really quickly. Look at how complex this graphic is, right? So one of the rules that Sarah pointed out earlier, the first rule is break all of them. And this one does, right? This infographic, there's a lot on here, right? This is there's a ton, it's tiny. But this thing was killing it. It was really, really spreading. And the topic, as you can tell on the left, it's the causes of antibiotic resistance. So this was their best performing post by far. Was all over the place. And you can see from a metrics standpoint, about 3% of the people who were seeing it were engaging with it. That 3% was enough to really ricochet this thing on. About 0.2% were sharing it of the people engaged, and about 17% were viral. Meaning that it was, and again, because this was not paid, this was organic only, that means that it was reaching about 17% of the people that were being reached were not their fans already, right? So this was really doing a good job of reaching out through their community. But that 0.2% share rate tells us they weren't moving beyond them, right? It was incredibly powerful for their community, but it wasn't going far beyond it. So we, constantly talking about how do you make those value props clearer. And the team went back and they're like, well, we have an idea. And I think it was like the next day, we look on their page, and they've simply posted the exact same thing, which is what we often will say, if it doesn't work, try something else. If it does work, try something else, right? It's that constant learning. So they posted the exact same thing, and they took out up above on the left, they're just repeating everything you see in the graphic. On the right, what they did is they just made the value proposition very clear in the form of a question. So it looks like it's a question, but actually it's an answer, right? What are the causes of antibiotic resistance? Over here, 5% engagement, 20% of that engagement were people sharing it, because it's clear to me the value of this content to my friends. It's clear to me how this can make a difference, right? And 80% of the people who were seeing this and engaging with this were outside of their existing fans and friends. So this gives you a sense of just like, what does that look like to play and learn and iterate? This was, I just thought this was a wonderful example of that.
And so here's another example. This is a page like ad. And so you can, when you create a page like ad, it takes a picture of your page a little bit. So you'll see on the left, it says 617 people like this, and on the right, we were playing and testing to see which page like ad does better. And on the left, it did pretty good, right? $1.50 per like. And on the right, it did great, 5 cents per like. And on the left, I really think about this statement as the vacation photo of organizations, right? This is what Global Health Hub does, right? They spread the word about global health issues from pandemics to new research and more. And there's no room for me in this. I can't really share this for my friends and family and define myself, or I don't think it's really useful to my friends. It's like I would never share my friends' vacation photos. But over on the right, health is the first of all liberties. Now that's a statement I can get behind, right? That's a statement that I want to define myself by. So that's something I will share. That's something I will like. So that's just one way to think about how you capitalize on the ways and the reasons why people share.
This is a funny one to share with you all, because we would never recommend doing a like campaign. Normally, we were doing something very specific, trying to build a test page that we wanted just enough users to make it credible. But this just happened to be, I think, a really, really good example. But I mean, you think about the difference here, the delta between, good to great, $1.50 to 5 cents. What is that? I don't know. I can't do the percentage. I'm sure people are doing it in their head, but that's the kind of thing we're looking at. We can tell stories of, 10 cent signups versus $150 signup for email lists or things like that. So there's no golden rule that you should be, here, but you do know it when you see it, right? So in this case, it was very clear to us what was working. And we didn't set out to create, this is one of those things where it's like, we didn't set out to create the vacation photo version on the left. We were just creating stuff, right? It's like, yeah, that sounds good. And then, we kept going, and it's usually when you get to the 5th or 6th title or headline or whatever that you start kind of, getting sick of the stuff that's in your head as a professional, and you start saying things that are more interesting. And that's really what happened there was, we were experimenting and playing, and then we realized, oh, that's why. After the fact, you often figure out why something worked after the fact, even before, as opposed to before.
So Drew, that's actually our last slide, which is perfect.
Awesome.
Because we have plenty of time for questions. So I'm going to stop sharing my screen so we can just open it up for questions.
And this is the sort of the Stump the Jump section. It's always kind of fun. So feel free to throw questions over to the right. If you feel comfortable raising your hand and speaking up, we can call on you. If you want to just jump in and open your mic, we're happy with that as well. So no dumb questions. Yeah. No questions.
This is
okay.
Sarah. I'll just pose one. What is probably the most surprising piece of content you put out there that did really well, that you were just like, you were experimenting and then like, whoa, looky there?
I'll tell two stories there. One is a project we did in India, in northern India, that was aiming to increase that iron folic acid uptake amongst young women. So you can imagine that I have a lot of deep knowledge and insights about that audience, right? Being, myself here in Portland, Oregon. So, but often Sarah and I we'll make bets like, hey, okay, which constant you think is going to work and what do you think is not going to work? And this one piece of content that was this, it was this awful looking sort of metallic plaque looking thing. And I think maybe it had a karate person on it or something. And it was like, both of us were like, there's no way that's going to work. I mean, if we had our like, sort of filter hat on, we never would have let those go live. It was the #2 most effective piece of content amongst 400, right? So that was literally like, we sat down and we went through, what do you think is going to work? What's not going to work? And we did guess, I think the first one, the #1, I think we actually did. I think it was the girl on the skateboard maybe. But this other one was like, what in the world happened there, right? that was for me one. The other thing, I will tell a story that I think is not necessarily, was not one that we were behind, but I was asked to sort of analyze a campaign that an organization here in the US did, where again, a number of months before, I had really kind of turned the screws on them to increase, kind of move toward more of a quantity first approach. And long story short, this campaign that they ran had an incredible result. It was like 12% increase in the likelihood of people saying that vaccines were important, which is a phenomenal lift. And somebody asked me, hey, will you take a look at this and help me figure out what the heck happened? How did these guys pull this off? And so I went in and happened to be, go into their ad account with their permission. And my answer was, the answer to the story is they did 50 pieces of content and 3 of them killed it. That's the done, right? They tested lots of things. That's the real story. But the content that really worked, that we're using this in Nigeria. I mean, I'm like, oh, this is so brilliant. And again, they didn't go into it knowing this was going to work, but it was brilliant. Was an article that was the five things every fully vaccinated person needs to know. And you think about that, it's like they were writing it with in mind of, we're writing to people who are fully vaccinated. But think about what that does to someone who's on the fence, right? That's like catnip to somebody who's really still really on the fence and trying to decide, is this valuable? The content killed it, right? It did incredibly well. It was being shared, engagement rates. The other 47 pieces of content, they just didn't really go anywhere. But these 3, one was in Spanish, one was in English, and then one was a variation of the same thing, absolutely crushed it. And the impact was phenomenal. And, so again, it's one of those things where they didn't know it when they did it, but they did enough that they learned quickly. And I guarantee you they're using that same strategy over. We're using it, right? I mean, this is the benefit that we get is that we get to work with amazing people all the time and learn from them constantly. So like, I'm dying. I probably have 8 different variations of that exact strategy that I want to play with in Nigeria on the project that we're doing. But those are my 2. Sarah, I don't know if you have a. Oops, you're muted.
I want to make room. Does anyone else have any other questions?
Yeah.
Yeah, please go right ahead.
Okay, so we're all in public health. We're putting out messages about public health. Say we put out a piece of content, it has a lot of engagement, there's comments, but maybe when we look at the content, the comments, kind of trolly, skeptical, really hesitant, anti-vax, etc. Do those belong in do we measure those as part of our metrics? Where is there, is that part of what we measure?
You want to take
so
that? Sam?
I can take this one.
Yeah.
There's a couple of different things you can do here. So first, if it's distracting from the conversation, I recommend hiding that comment, right? Because there was a great study done at Stanford. They looked at how are trolls built. So trolls are built in negative environments, right? So the more negative your comment thread is getting, the worse it's getting. So I recommend hiding them. If you really feel like you cannot hide them, so we were working with this organization that has a policy that they're a government organization and they have a policy that they can't hide. What they actually do is they go in and respond, and they were actually trolling their trolls a little bit, which was hilarious, and it made everyone in the comment thread laugh. So doing that. And then when you are analyzing your comment thread, we're working with a team in Indonesia, and what's really interesting and the information that they're delivering to their programs team is that they do analyze in group comments, negative, positive, whether or not it's their routine immunization. So they also, are they a comment about they can't get these routine immunizations, or they comment about, the actual infrastructure, or they comment on something. So I think it's really important to analyze all of your comments, and I really encourage you to hide them.
Okay, but if we are wanting to change hearts and minds, bring people over from resistant to vaccine readiness, we should consider those, right?
Not if they're crazy. I mean, so remember, you've got the world is bifurcated into people who are already that are already in your target, that are already there, right? and that's great. I mean, it's nice. We like those people, but that doesn't do us any good to just reinforce where people are already at.
Yeah.
Then you have people over here that are just far gone, right? Honestly, write them off. Check, sorry. I mean, I know I'm totally callous, but it's true. Forget it, waste of your time. Then you have this huge chunk in the middle that's still like 30% of the population, right? Who actually, right now, they are still on the fence. And they're being influenced oftentimes more by these folks or more by these folks, but that's really who our target audience is. So I would argue that if you have somebody who's coming in who is just, you know, they're clearly just a troll, right? So first of all, never feed the trolls. There are people that's their thing. They want to go out and they believe it, right? They do believe it. They've fallen down so far down the rabbit hole. If your mission was to what's the word, kind of reprogram or deprogram people, then yeah, you would need to, you know, figure that out. But that's probably not yours. So what I would do is, like to Sarah's point, I would hide them. You can block them, but often hiding. So if you hide, they can still see their comment and their close friends can see their comment. So oftentimes if you hide it and you reply in a respectful, kind, you know, responsible way, then one, you're communicating back to them and you're showing them that you're genuinely care. And any of their friends who happen to see it are also going to see your rational thought process, right? They're going to see, because most of the people that are doing that, I mean, their friends all also are going like, oh my gosh, this is crazy. So I wouldn't spend too much of your time trying to persuade somebody who's you know, ship has sailed. I would really be thinking about that. You're trying to reach the people who are in that sort of, they're concerned, they're still weighing it, you know, whatever, depending on well, I'm talking about vaccines in particular right now. But I personally wouldn't spend a lot of time with people who are way down the rabbit hole.
Okay, thank you.
And Troy, there also are ways. One of the things that we like to do when we're running ads is we'll put a block list inside your page. You can import a list of however many words. You know, I guarantee every version of sheep and sheeple will be in that list. But you can create this long list, and what'll happen is that the Facebook system will automatically auto hide all of the comments that have those typical, you know, sort of brigader type of terms in them. And we have a list. We could, if you want it, we can send you a version of the list that some folks we've worked with have created. So that is one way to make that a little easier on you.
Yeah, that would be great. Thank you.
I know we're at time. Sarah, I think we're happy to, if you get more questions and gather them for us, I think we can respond. But I unfortunately have to go.
Well, thank you so much, Sarah and Drew. And as Sarah just said, if you have further questions, just send them to us. You can send them to communications@bayareaglobalhealth.org or send them to Madavi@bayareaglobalhealth.org, and we will pass them along and hopefully they'll be able to answer. But I just wanted to say thank you so much. I learned so much, and I just am so grateful to have you guys as wonderful members, but more than that, for doing the work that you're doing with so many different nonprofits around the world. It's just so important, and thank you for your contribution.
Oh, right back at you, Sarah. Thank you so much for all you guys are doing too. So awesome.
Thank you. Thank you,
Bye,
everyone,
everybody.
for joining us. Bye.
Thank you.